dizziness and vertigo, common feelings among fighter pilots on maneuvers. Also very common for the 11 million people around the country who complain about dizziness and balance disorders every year. With thousands going undiagnosed, many even see 4 to 5 doctors before finding relief. But now, diagnosing dizzy patients has become much easier thanks to the Balanceback Intuitive VNG system and its proprietary video compression technology developed by Dr. Frank Scarpino. By utilizing the same award-winning technologies Dr. Scarpino developed for the U.S. Air Force, for the F-15, F-16, and Predator, Balanceback has quickly become the technology leader.
We've developed this new technology in video processing that is particularly good at video surveillance. Not only does it provide higher rates of compression, but it also provides a great deal better video clarity than has been seen before.
He then teamed up with another world-renowned leader,
an abnormal finding on condition number 6.
Dr. Richard Gans from the American Institute of Balance. Dr. Gans has trained over 3,000 physicians, audiologists, and physical therapists from around the world, treated over 30,000 patients for balance disorders, and has formed an education foundation to provide the best training facility for clinicians worldwide. So when the Balanceback team and Dr. Scarpino approached Dr. Gans, it was a perfect fit.
And the opportunity to work with a world-class scientist like Dr. Scarpino and the other members of the team and actually design vestibular testing equipment from ground zero, and working with the engineers and technical folks was just an opportunity that I and my staff just couldn't pass up.
Gans also believes Balanceback is far better than what's currently available in the industry today due to its proprietary state-of-the-art software and hardware designs.
The equipment was built by clinicians for clinicians. I can tell you that I have been buying equipment for almost 25 years, and I have spent hundreds and hundreds of thousands of dollars. I know what's wrong with the equipment. I know why it breaks, when it breaks.
From that experience, Gans has been very hands-on in developing the Balanceback Intuitive VNG system with binocular video goggles. They're more comfortable and lightweight with less obtrusive camera placement. His biggest contribution? Making the software more clinically friendly.
The benefit of video nystagmography is that the eye is right there for the practitioner to use. So the practitioner can look at the eye to see if there's a torsional rotary type of movement, if there's somewhat of an oblique type of movement.
With information that detailed, diagnosis becomes clearer.
The Balanceback infrared technology allows us to clearly identify and differentiate the type of nystagmus, the intensity of the nystagmus, and that allows us to identify which ear is involved and which balance canal is involved.
The Balanceback Intuitive VNG system provides these diagnostic readings through individual testing modules, including Dix-Hallpike, ocular motor testing through saccadic pursuit, pendular pursuit, and optokinetics tests, gaze testing, high-frequency head shake, positional testing, and caloric testing. 2 exciting examples of proprietary features developed by Balanceback are the magnified eyes feature and instant playback.
Right there in real time, the clinician will be able to see the eye movement, they will be able to replay it and see instantly what just transpired.
Another proprietary feature of the Balanceback system is the Gans logic tree.
What the Gans logic tree does is basically take my 25 years of experience and 30,000 patient database, and we've culminated that into what we call a logic tree. It will pull together all the abnormal findings, collate them, and then give the practitioner a summary of what this intelligent report writing software believes the most likely profile for this patient is.
If a clinician has a question, a built-in educational system called the Video Professor can assist the user.
You are about to perform the saccadic pursuit test. If the user needs to get a little refresher on what they're supposed to do, how to prep the patient, what the instructions are, a little video prompt is going to come out, and actually explain to the user what to do next.
As a result of the treatment, no other system in the world compares to Balanceback. As part of the Balanceback training and support program, AIB's Education Foundation will provide hands-on education covering clinical strategies and one-on-one training, custom designed for clinicians utilizing the Balanceback system.
So they're going to be getting the same type of education that they would be getting if they went to a doctoral level course.
Once you leave the facility, help is just a mouse click away, with 7 faculty members ready to assist you in working with your patients.
We have 2 PhDs and 4 doctors of audiology, and a master's level physical therapist.
You'll get immediate answers to your immediate questions.
We will actually be able to hook up to their computer, see what they're actually seeing, perhaps in real time, and be able to help them immediately.
So whether it's clinical assistance or confirmation of a diagnosis, personnel from the American Institute of Balance will be a phone call or just a click away through secure internet connectivity. And since medical science and technology continue to change at a dizzying rate, Balanceback's partnership with AIB will get you the new breakthroughs as they happen.
We want to make the practitioner's life easier, simpler. And in doing so, we're going to make sure that patients with intractable chronic dizziness, vestibular imbalance problems are given the very best care possible.
To learn more about Balanceback, visit us online at www.balanceback.com or call 877-63-DIZZY.